Hello, folks. Welcome to Med Basics. My name is Dr. Vandana, and today I'm going to talk about basic word structure from medical terminology course. Okay, so we are going to start with the classification of medical terms. Now, the medical terms has been categorized into three types on the basis of the words that has been constructed or derived from. The first category is Latin or Greek word parts. Now, these terms are constructed from roots, prefix, or suffixes derived from Latin or Greek. They usually describes anatomy, condition, or treatment. For example, cardiology. If I break this term, cardio and logy, cardio stands for heart, logy is study of. Similarly, tonsillectomy. So tonsils and ectomy is a surgical removal procedure. If you have noticed in both this terminology, the anatomy and treatment procedures are been included. So these are examples of Latin or Greek parts. The second type is person name or eponyms. Now this is very interesting because here the terms are derived from the name of people, typically doctor or researchers, who first discovered or described this for the first time. For example, Parkinson disease and Alzheimer disease. Now, these are name of a person. So if you want to identify the meaning of this term, it's not possible, right? Okay. So if the name are derived from the name of a person, okay, then we categorize it under eponyms. Now, the third category is a modern English word, and these terms are often derived from common English language. And this is widely used in both medical as well as everyday setting. For example, magnetic resonance imaging, right? Which is a common diagnostic imaging technique, right? And similarly, irritable bowel syndrome. So we refer it as IBS acronym, right? And we know this is a gastrointestinal disorders. So these are modern English words, right? So I hope now you have clarity, different categories of medical terms, Latin, Greek, person name and eponyms, and modern English word. And please be mindful, the majority of medical terms are built from Latin or Greek words. Okay. Okay. Now, this is the arrangement of medical terminology. So there can be, these are the major components of medical terms, right? It is not necessary, like every medical terms would be having all these four components. Some may be having two, some may be having four, some may be having three, right? Okay, depending upon the medical term. And before we learn medical terms, we are going to learn about these individual components in detail and uh, have our basics clear, right? So first we are going to start with the word roots. Now this word root is a foundation of most medical terms, which gives essential meaning of a term, right? So if I have to underline, right, or identify which one is a root word, so I'm having this rule, right? So the root words or the word roots are majorly body structure, organ, or body systems, okay, right? So if you are naming any of these, right, it would be your word roots. Come on, let's have a look. Here we have some examples. These are the common names, right? And this one are medical terms. Fine. So if you see joint, right? So we know joint is a part of your skeletal system, right? And this is a common name. The medical term is arth. Similarly for nose, it's rhino, right? So here, if you see, if you have noticed, right, these whatever the common names or examples has been given, they are either organ, part of organ or organ system, right? Or the entire organ system, right? Okay, fine. So this makes word roots. Fine. Okay, now you are having one exercise to do, right? Here I have listed three medical terminologies and you have to identify the word root. You have to ignore suffix, prefix, whatever is there, right? You have to simply highlight or underline the word root. Okay, have a second to think. Okay, so here in the first terminology, hemat. Okay, so hemat is a blood, and we know blood is a component of your blood system or circulatory system, right? Okay, so again, this is a part of organ system. So this is going to be the word root. Okay, similarly, arthritis, right? So if I break this term, itis is a suffix and arthro is a joint. Now, joint is a part of organ. So part of organ is a word root, right? Similarly, nephrology, right? So if I break this term, nephro and logy. So nephro is kidney and kidney is a part of organ system, that is urinary system, right? Okay. So this is going to be the word roots, right? I hope the word roots are clear to you all. Okay, since we completed with the word root, now we are going to talk about the suffix, right? Okay, now when we talk about suffix, right, they are found at the end of medical terms, right? And they majorly provides information about the word roots and they majorly relates conditions, disease or procedures. Fine, okay, let's have a look. So these are again the common names and these are the medical terms for it, right? We are talking about suffix. That means the terms has been added at the end of term, word or terminology. Fine. The first terminology is ectomy. Fine. So ectomy means surgical removal of something. Fine. So if you have noticed, this is surgical removal. Okay. And what the rule says? Procedure, right? So procedure inclusion. Similarly, inflammation, itis. So again, this is a condition. Study of logy, enlarged megale, right? So again, this is a condition. Disease, pathy. Again, this is a condition, right? So what is suffix? They are added at the end of medical terms, and they can provide information about the word roots by conditions, disease, or procedures. Okay, and here we have seen a couple of examples, right? Okay. Now, since we completed word root and suffix, now we are going to talk about the combining vowel. Okay, before we start, have a look on its arrangement, right? So, combining vowel is placed between word root and suffix. Okay, so this is the ideal location. Fine, okay, or the placement. Now, combining vowels are used to connect word part and make the terms easier to spell and say. Okay, now very interesting fact, right? And very well known as well. So we all are aware vowels. So we have five vowels A, E, I, O, U. Okay, and apart from vowels, whatever remains in alphabet, they are known as consonants. Fine. We also know what is the purpose of vowel. So vowel helps us in easy or better pronunciation, right? Okay, let's have an example. If I say cardi, right, and not adding O, right, which is a vowel, the pronunciation is very difficult, cardi, right? But if I add combining vowel to the word root, it becomes cardio. The pronunciation is much better. Similarly, nephro and nephro, right? Okay. So we know the purpose of vowel is to ease and better the pronunciation, right? That's why word after word root combining vowels are added and suffixes are at the end. So by default, the position, okay, or arrangement of combining vowel is between word root and suffix. Fine. Okay. Now we have to understand where we can place this combining vowel. So one location we already know, one arrangement between word root and suffix. We have to place this combining vowel. Okay. And the second arrangement could be between two word roots. Okay. Two word root means two organ or two parts of organ or two organ system. For instance, let's have an example. Intestine, right? Okay, or better example, gastroenterology, right? So if you have noticed, gastro is a stomach, entero is a intestine. Both are organs. Fine. Now, since both are organs, what the rule says, if there are two word roots, we have to combine it with the combining vowel, right? So instead of writing gastroentero, right, we would be using gastroentero, okay, or enter, because we don't know about the suffix yet. But yes, if we are not adding a suffix, we can definitely add combining vowel to it, right? Okay, so you have to remember these two rules, okay? So combining vowels can be placed between word root and suffix, okay, and between two word roots. Fine. But again, be clear, we cannot use combining vowel between prefix and word roots. Okay, fine. So either you can use between two word roots or between word roots and suffix. Okay, clear? Now, but whenever we are using this combining vowel, there are some rules, and there are three major rules, right, that you have to follow. If you're not following, then there is a full chances that you will do mistake and you will lose your marks, right? So the first rule says if the suffix, okay, suffix means the which has been added at the end of term, right? So if suffix is consonant, right? Consonant means other than vowels, right? So if it is consonant, but first alphabet, right? So if first alphabet is consonant, you can add combining vowel between word root and suffix. Okay, if it is consonant, so here you can see L is a consonant, right? So you can add O, so the term would be hematology, right? Okay, similarly cardiomegaly, so cardi and megaly, right? So M is again a consonant, not a vowel. So since it is a consonant, you can add combining vowel, right? So the correct terminology would be cardiomegaly. Fine. Okay, if it is consonant but first alphabet of your suffix, this you have to check. This is the first rule. Okay, what if there is no consonant and there is a vowel in the first alphabet of suffix? So in that case, you don't have to use combining vowel. Okay, so this is the second rule. So here you can see the example. The terminology is arthritis, right? Okay, so here you can see this is suffix and first alphabet of suffix is I, right? So since it is a vowel, we are not going to put combining vowel between word root and suffix, right? So the correct terminology would be arthritis and not arthritis. Fine, this would be incorrect. I hope it is getting clear now. So you have to just remember uh, the first alphabet of your suffix. If it is consonant, right, we can add O. If it is vowel, we have to ignore adding combining vowel, right? Okay, so we have to ignore it. Fine. Now, third rule is between two words, right? We have already discussed, right? So here gastro is a stomach, entro is a intestine. Now gastro and intestine both are organ, which means both are organ word roots, fine. And between word roots, we can add combining vowel, fine. But between word root, the last word root, and the suffix, again, we have to check this rule, fine. So if the first alphabet of suffix is consonant, I will be adding O, right, or combining vowel. If it is I, right, I mean vowel, in that case, I won't be adding this combining vowel, right? So the terminology gastroenterology is correct, okay, but if the condition is gastroenteritis, right? So itis is a suffix, would be having I, so I won't be adding O just after enter in that case. Fine. So I hope you are, I mean, the rules are getting clear to you all. Fine. So this is the rule for combining vowel, right? So you have to check for the suffix. If they are consonant, you would be adding combining vowel between word root and suffix. But if it is a vowel, okay, first alphabet is vowel. In that case, you have to ignore adding combining vowel, okay? And the another rule says if there is a two word roots, so you would have to add combining vowel between word roots, okay? But whenever you are adding or you are having suffix, okay, then you have to check the first alphabet of suffix, okay? Now, since we have completed word root, combining vowel and suffix, now it's time to talk about the prefix. Okay, so prefix is found at the beginning of medical terms, and they are going to provide information about, again, word roots, right? But what they are going to relate? They are going to relate abnormal conditions, numbers, positions, times. Okay, and one thing that you have to be very clear about it is that medical terms, I mean, many medical terms won't be having prefixes, right? Okay, so it is not necessary every medical term would be having prefix. There are many medical terms who are not having any prefix, right? Okay, so here we are having few examples. We would be having a separate session on detailed prefixes and suffixes and some tips and tricks in remembering those medical terms pertaining to prefix and suffix and word roots in our upcoming sessions. Okay, but for now, right? So if there is a prefix a, it means without. By is to. So we have already seen the rule, right? So it represents numbers. So here you can see by, right? So to. So by is a prefix. Similarly, dis, abnormal, difficult, or painful. Now this is again a condition, right? So abnormal condition, which has been mentioned here, right? Post is after, sub is under. Okay, so don't worry, we are going to see this in detail in our upcoming sessions. Okay, so we are done with all the four components in the basic word structure of medical terminology, and we are quickly going to summarize whatever we learned from our today's session. So prefix is affixed at the beginning of word, right? We all know, and we also know that most of the medical terms are not having prefixes, right? The word root or combining vowels provide the primary meaning of term, correct? Suffixes are fixed at the end of word, okay? And we also know like combining vowels are added between word roots and suffixes. But again, you have to know the rules. If the first alphabet of suffix is consonant, right? We are going to use combining vowel between word roots and suffix, but if the first alphabet of suffix is vowel, then we would be avoiding adding them, right? Okay, so we are having five vowels, right? But the most common vowel used in the medical term is O, right? And infrequently used vowels are I and E, right? Okay, now when using combining vowel, right? Adding suffix begins with consonant or when combining two words, right? So we have already discussed this. And when the first alphabet is um, vowel, in that case, we would be dropping, adding, combining vowels, right? Okay, so this is the last slide. And now you already have the clarity about the word root, suffix, prefix, and as well as combining vowels, right? So here there are different medical terminologies with the building word cardio, right? So cardio is heart, right? So cardi is root word and O is combining vowel, and we already discussed, you know, combining vowel always helps in better pronunciation. So instead of pronouncing cardio is much better. Fine. So here the building word is cardio, and here there are multiple medical terminologies. Okay, uh, having this cardio as a building word, right? And now we would understand. I mean, we would revise all the key learnings from our today's session. So here you can see bradycardia, right? So if I break this term, brady and cardia, right? So cardia is a word root, and we know heart, right? So word root. So whatever is before word root, it would be prefix, right? Okay. Similarly, here we are going to break this electrocardiogram. So there are three terms in this terminology, right? So first one is elect. Now this is also a root word. I mean, word root. How I determine? Because here I can see, I mean, you all can see this is O, right? Okay. And the rule of combining vowel. Combining vowel can be added between two word roots, right? So here, since O is before this root word, right? So this would also be a root word. I mean, word root, sorry. So word root, okay? And then here you can see this gram is a suffix, okay? But here again, you can see the first alphabet is consonant. That's why we have added O, right? So the term is electrocardiogram, in which there are two word roots and one suffix. Fine. Okay, now we are going to see the third terminology, that is carditis, right? And here you can see if I break this card and itis. Now itis is a suffix, and here you can see itis first alphabet is vowel, right? So since the first alphabet is vowel, we have not added combining vowel. So the terminology would be carditis and not cardioitis. Fine, okay. I hope the things are getting clear to you all. Okay, next one is cardiomegaly. So if I break this terminology, right? So M is the consonant, right? This is a suffix, megaly. This is a suffix. M is a consonant, right? So I can add combining vowel between word root and between suffix, right? Similarly, cardiology. So again, here this is a suffix. So L is a consonant. So I have added combining vowel, right? And similarly, pathy is a suffix. So the first alphabet P is consonant. So I have added combining vowel, right? Okay. So you can practice more terminologies from your textbooks. And I hope this introduction or the basics to uh, word structures are clear to you all. So I'm completing this session and we would be meeting in the upcoming session. Uh, I hope you all enjoyed and you all had a clarity over this topic today. So if you are ready to learn smarter, not harder, hit that subscribe button and turn on notifications so you never miss a video. And don't forget to like and share this with anyone who could use some help mastering the med basics. Thank you so much.